Important topic, nephrotic syndrome. So we need to ask how it has been started. And nephrotic syndrome is associated with generalized edema, hyperalbuminuria, and hypoalbuminemia. For that reason, the edema results. And edema used to start it around the periorbital region, then it becomes dependent. And how is the progress and how long these things are happening? Aggravating factors could be infections, relieving factor could be medications, and it's sometimes associated with nephritis, SLE, heavy metal exposure, congenital causes, and infections like hepatitis B, chickenpox. Complications could be ascites, pleural effusion, edema, thrombosis, infections, and hyperlipidemia. Important negative history you need to ask in relation to renal, GI system, CVS, and respiratory. And how is the V? How is the poo? Any past history of similar illness like relapses? You need to know how is the frequent relapses. There is not and any past surgical history like kidney biopsies, past hospital admission, ICU admission. In general, we used to do full blood count, use NEs, LFT, glucose monitoring, blood pressure and weight monitoring, urine deep results, ultrasound scan, C3, C4 level, varicella zoster, hepatitis B, hepatitis C serology, and autoimmune screen. You need to ask any of them has been done or not. Treatment is mainly prednisolone. Most common side effects are weight gain, Cushingoid feature, short stature, gastritis, osteoporosis. In some rare cases, we used to use cyclosporin, mycophenolate mofetil, albumin, and furosemide in certain cases under nephrology guidance. And compliance and side effects are to be inquired. Consultants mainly involved are general practitioner, general pediatrician, nephrologist, nephrotic nurses, sometimes psychiatrist. You need to ask the brief birth history. Immunization is very important. You need to ask whether the patient is vaccinated against the pneumococcal, meningococcal, HIV, Haemophilus influenzae. All of them are capsulated organisms. And you need to inquire about the live vaccines. Sometimes they are not effective due to steroid therapy. After immunization history, you need to ask about the nutritional history, whether any nephrotic diet is given or not under dietitian guidance. Low fat, low salt, normal protein diet. Development history, you need to ask the brief development history, pubertal history, allergy history, family history of similar illness, any major illness in the family, consanguineous marriage. You need to draw the family tree and how is the family dynamics. Social history, any laws of school days, how is the academic is going on. Is there any history of bully because of the Cushingoid feature, virilizations? How is the home condition, any education healthcare plan, any social support the child is getting? How these things are affecting the child's life and how these are affecting the family. And you need to ask you need to know what are the indication of kidney biopsy when the patient's age is below 1 year or above 12 year, persistently low C3 level, persistently high blood pressure, persistent hematuria, frequent relapses, steroid dependence, steroid resistance cases. We may need to consider kidney biopsy and refer the patient to the nephrologist. Thank you.